So today I am going to be presenting about this graph here, or these two graphs. Sorry, I tried to screencast this on my computer, it didn't really work, so we're going to go with this. One thing I want to point out is that for the ED rate on the left-hand side, for Minneapolis, the scaling is much smaller, maxing at 120, and the scaling for SF is much larger, capping out at 200. And as well as the Google search side, 250 for San Francisco and 400 for Minneapolis. So with that aside, you can see that Minneapolis has an increased trend and San Francisco there's a decreased trend, and I believe that these trends are most commonly referring to these two drugs here, the two dashed ones in the middle, along with these two dashed ones in the middle as well. I am not including these dashed ones on this dotted one on top because in this case it's going up, in this case it's staying stable, but it still goes down. So I believe that in these two scenarios that this dotted one, which I believe is brown sugar, does not play a role in these trends with heroin and ED rates. I do believe that these two though, these two dash lines, I would tell you, but the graph came out black and white, so I can't really tell, which one's which, but you can see that these two increase and these two decrease, and it goes along with the general trend of decreasing and increasing. So that's about it.
Hi, this is Patricia, and I'm going to talk about Article 1 and my opinions about it and some further suggestions. The opioid epidemic, which started around the 1990s, is still today's public health crisis. And public health professionals, along with healthcare companies, are still trying to combat this issue in the most efficient way possible. The first article talks about addressing this problem using the internet and data gained from Google searches. And the result shows that there is a correlation between higher rates of heroin-related ED visits in regions where there are more opioid-related Google searches. Thus, this is one method that professionals can look into further to solve the opioid epidemic. In my opinion, although I think this is a great idea, we need to look for something that's more preventative. Getting data from Google searches can only predict the number of heroin-related admissions, but it does not reduce it. I think increasing mental health facilities and decreasing the public's access to opioid-based medicines will be the next step. A study by Rutgers University also suggests that mindfulness practices can help reduce opioid cravings. And another suggestion is to educate the public or those who use opioid-based treatments on how to dispose it properly.
In Article 2, the role of predictive analytics in clinical care, they define the application of machine learning and artificial intelligence to healthcare as predictive analytics, or they call it PA. This is great because computers are more accurate to doing things that are more monotonous and repetitive, such as reading X-ray images, and they can perform those 100% more better than doctors. In my opinion, I think it's great that we can implement tech and health together because the only outcome is that the patients will benefit from it. But if any stakeholders or any mistake was made during the production of technology, it could prove fatal to them as well. And another problem this poses is that physicians will be the one to blame if the algorithm is wrong or if it mistakenly treats a patient, and this would make others more distrustful of it, of the software and the doctor themselves. Currently, I know the technology is being continuously integrated into the medical field, and the day that the negatives outweigh the positives, that's the day I think we must all really sit down and have a talk about what we need to do next for what's best for the patient. And big data's promise for improving the quality and safety within healthcare may seem full of possibilities right now, but it comes with a small risk that I think we should all really take into understanding.
Hello, I'll be briefly discussing the challenges to consider associated with predictive analytics in healthcare. Predictive analytics can potentially benefit the medical community in significant ways, varying from tracking Google searches, as described in Article 1, to creating new drug therapies individually chosen for each patient based on their genetic makeup. But as with anything, predictive analytics brings a discussion on legal and ethical uses and implementations. Concerns of predictive analytics varies due to PA systems consisting of data from an entire population and considering historical abuses of data. Certain groups of people, like people of certain economic status, ethnicities, and living in certain neighborhoods, along with people with disabilities or at high risk of hospital visits, can be excluded from getting the medical care they need. Along with these points of concerns, predictive analytical errors like flawed implementation can do more harm than good to the patient, ruining the public's trust in their medical community. To limit these situations from happening, PA models need to be constantly updated and evaluated in order for the public to receive the benefit of the system. the promise and hope for a more efficient and cost-effective approach to healthcare. Thank you.
Hi, I'll be doing a comparison of the two articles for this week. So in Article 1, researchers were able to utilize the benefits of predictive analytics and big data to uncover information about opioid use and develop tools to help predict patient hospital admission as it related to like heroin use. In the second article, this benefit is articulated and talked about, but at what cost is that information being retrieved and how honest is it actually? Predictive analytics comes not only from an individual's internet searches, but also ads and content that they interact with. Based on the massive platform that social media has created for ad and content sharing, this creates kind of a skew in the validity of what predictive analytics offers. Moving forward, we have to decide the best way to use this data. I think it's important to remember that internet browsing history doesn't always reflect the interests of a person. That kind of really specific scope requires a lot more individual attention.